Zach here at Pello Fitness, and today is Parenting and Fitness Podcast number 4. We are going to discuss how to prevent back pain pre and post pregnancy. I'm telling you, we have a special guest. This guy is awesome, and his name's Dr. Alec Domjan. He specializes in back issues, and he has a lot of knowledge, and he's going to bring a lot of value to you. I'm going to go ahead and pass over the mic to him to let you guys know a little bit about himself and where he's coming from and who he serves.
Yeah, so my name is Dr. Alec Domjan. I am a chiropractic physician in the Indianapolis area, and we work with a lot of patients, particularly low back pain patients from a variety of demographics, but we see about 40 to 50 pregnant women pre and post-op about a year. A lot of the times they come in and they're talking about low back pain. So it's something that we've had to spend quite a bit of time in learning and developing our skills and giving these women the tools to be able to manage their own condition.
Yeah. I'm sure you can see this a lot. It's something that I hear about all the time. Even especially during pregnancy is a big issue, but I hear a lot of times people get sciatic issues post-pregnancy, and it really affects their ability to exercise sometimes after the fact. And of course, I think we all want to tell people that if you're having a lot of issues, definitely seek out some help. And Dr. Domjan here is a great person to go see. So so let's get started, just kind of get going here. Well, first of all, what drove you into this profession? I think that's a great question.
Yeah, that is a good question. So like a lot of my patients that have come and seen me, I was in quite a bit of shoulder pain actually, and I had received various different types of care, but I hadn't really been making a lot of progress. I was an athlete in college, and so swimming was a very big deal in my life. And when you have shoulder pain, you can't swim much. And it wasn't until I saw a chiropractor who was able to help me, look at me from a lot of different standpoints, help me on the rehab as well as soft tissue and joint mobility side of things, that I really started to see progress. So I just loved how hands-on and how just in touch you were with your patients as a chiropractor. I get to see almost immediate results, if not immediate, but it doesn't take much time for me to see major results for these people that have had all these different types of pains and symptoms. So for me, it looked like it was very rewarding, and I can honestly say it has been since being out in practice. And so that's kind of what led me to this route.
Yeah. I think people sometimes don't realize until they have an issue how much of an emotional impact this can make on your life.
Yes.
It really can control us. And so it's so important to understand what's going on, because a lot of times it might feel worse than what it is, but you need to get checked out regardless, but it doesn't mean it's a death sentence. And it's like, you can still get progress moving forward. And it doesn't mean that we have to completely change our lives, and I think people sometimes get fearful of that, especially with low backs.
Yeah, I would certainly agree. I think a lot of people, when their low back's hurt, they go into this mindset that they're fragile, that they can't move, that they shouldn't be working out. And ironically, it's those things that are actually going to be what gets us better. But there's definitely that moment where you feel like, it hurts to move this way, it hurts to move that way. I need to shut down movement like that. And so I think we've all been there. Everybody's had one or two low back pain episodes in their day, and it's figuring out how to manage that and go throughout our day and give ourselves the confidence we need to know that we're not fragile.
Absolutely. Yeah, no, that is perfect. So can you give us a little insight as to what happens during pregnancy to the body and why that could lead to some sort of issues? What changes goes on when a woman gets pregnant?
Sure. Well, so the most obvious one is the increase in mass in the abdominal region, right? What people may not understand is that is an extra 20 to 40 pounds that's right in front of you. And what that does from a biomechanical standpoint, that completely shifts your center of gravity. So what happens when you have more weight in front of you like that, it causes your body to put more stress on the structures of the low back, right? So some of these muscles that are normally meant to use for like postural coordination through movement, just even standing, sitting, things like that, they're now being stressed to accommodate the growing mass for the child, right? So even as you are pregnant, or even post-pregnancy, these muscles are still very stressed and they've gone through a lot of trauma themselves during this whole process. And so typically during that, our low back is what takes the brunt of that pressure and that stress.
Yeah, that makes sense. I mean, obviously it's stretching all of the stomach muscles out, right? Would you agree with that in terms of, and that can cause a lot of instability? Is that true?
Yeah, very much so. So some of the most common muscles we use for like low back stability, so the external internal oblique, as well as the pelvic floor muscles that all work in coordination to give our mid to low back stability. Well, these are the muscles that are also the most commonly ones stressed throughout pregnancy and afterwards. So when we don't have great motor control, when we're not using those muscles properly, basically prepping them for the birth, right? We tend to overstress our low backs, and that's when you run into the low back pain symptoms.
Absolutely, that makes sense. Yeah.
Right. So that's more of like the mechanical cause of low back issues. Now, obviously, there's hormonal factors too, right? So there's a hormone called relaxin that's produced by pregnancy. What that does, if you're not familiar with it, it basically softens the soft tissues around the pelvic floor and the hip. Well, that's a good thing. You want that reproducing in your body to be able to make birth easier. It does create more pliancy within the soft tissue, which leads to increased instability with areas like your low back.
Yeah, that makes sense. It is pretty crazy how the body adapts so much, and being able to have babies. I mean, women's bodies are crazy. How they can use the hormones like this affect just the ability for things to relax like that. That's pretty cool how that works, and I can see how that would cause a lot of problems. Now, what would you say? Would pregnancy typically cause people to go into more of an anterior pelvic tilt?
Yes, 100%. And that's, again, that just goes back to the change in the center of gravity, right?
Yeah, yeah.
You're more forced to compensate for that. And when that happens, that's when you put a lot of the stress on the muscles and joints of that low back there. So yes.
Okay, cool. Yeah, that's what I always felt. At least that made sense to me. You stretch out the stomach, it's naturally going to cause a lot of times people's pelvis to dump forward, which is also maybe going to create a weird environment or an environment that's not suitable for core stability, right? Where your diaphragm can't properly work. And like you said, the pelvic floor muscles, that's one area I would like to learn more about.
Mhm.
And if anybody's in or watching this, are there any resources that you might recommend to learn more about the pelvic floor?
Oh my gosh. Yeah. So like typically when people think of pelvic floor issues, they automatically think of just Kegels, right? Kegels is a great resource to utilize, but it's not like the end all be all. It's like not where the road stops, right? So one rehab technique that we commonly use in the office is called DNS, which stands for dynamic neuromuscular stabilization. And what it does is it's a rehab technique that involves loading the core in a way that also activates your pelvic floor muscles, gets your diaphragm down, and gives you some of that low back stability. So whenever I have one of the most common issues in pregnancy is pelvic floor dysfunction, right? During and afterwards. So utilizing some of these concepts with the low back stability, we can approach the same way as pelvic floor dysfunction, right? Like rehabbing these muscles and working them in a safe way to not only include a nice birth there, but also that we don't have any pelvic floor issues post-op either.
Oh, that's great. Thank you for filling me in on that. So DNS is something that you would recommend at least people look into as an option to work on their pelvic floor issues, possibly.
Yes.
Okay, cool, cool. That's great. And obviously, talking that kind of goes into the idea of what can we do to prevent some of these issues that will occur pre-pregnancy, post-pregnancy, even with people who are not getting pregnant. What are your recommendations? So, like you said, doing the DNS, the pelvic floor work is important.
Mhm.
What about diastasis? First of all, do you get that a lot? Do you see people that come in with that issue?
Yeah. So what a diastasis recti is, it's basically it's a separation of your ab muscles here. It's like the muscles that form your six pack, right? These are the muscles that we talk about when we're talking about a diastasis recti. So typically what that is, that's over dominance of those trunk flexors, what you use to bring basically your body to your hips there, and actually decrease activation of the oblique muscles of the abdominals, right? So going back to DNS, that's exactly what that does. There's other exercises you can do for it too, but activation of those muscles actually causes a decrease in the diastasis there. We've seen, it never will completely go away necessarily, but you can definitely, it helps rehab the abdominal muscles a lot, and you won't have as much as an accentuated diastasis. So that's a very, very common thing seen post-pregnancy.
And what were the exercises that you might recommend for that
Yeah.
again?
So it's stuff that I know that you're kind of doing with clients already. It can be part of the principles of DNS play into something as simple as like a dead bug or a bird dog. So loading those core muscles, keeping really, really good pressure in your belly as you're doing that exercise. As you're breathing into the belly and expanding and keeping that brace, that's what's loading these oblique muscles. That's not only protecting your back, but decreasing the amount of dysfunction in the ab during pregnancy and afterwards.
And with this, are we trying to I don't want to say avoid, but are we trying to not target the rectus abdominis, the big muscles right in the front? Are we trying to kind of not overuse those during these exercises?
Yeah, you're exactly right. Yeah, so that's not the focus here. Like our focus isn't to do crunches and say we're working obliques, right? Like if you want a six-pack body, that's the way to go do that. But if you want to work those other muscles around your abdomen, it's not just focusing on rectus abdominis, right?
Yeah. I usually won't have clients do crunches very often, anyways, regardless if they're after having a baby or not. I just find that people need to work on core stability more so, and like you said, working the obliques. That's a really important area. So the bird dog, guys, that's seems like a simple exercise, but when you do it right, it's pretty darn challenging. Make sure you're not shifting your hips side to side. Make sure you're bracing your core, and just like Dr. Alec said, and the dead bug, same thing. Make sure you have good internal pressure, uh, feeling your obliques, and make sure you're not arching your low back, as you lower the legs. That's really important. What in terms of other exercises can we do to help prevent issues outside of just regular core work?
Right.
With people are going to want to know, can they do squats? Can they do lunges? At what point would you say, don't do that? Like, just go ahead and give me your thoughts on exercise post
Sure.
pregnancy.
So just to talk about it even during, there's a common misconception that because we're pregnant or because we just had a kid, we can't work out, right? Like working out is bad for us. That's absolutely not true. In fact, if you look at the research, what they're saying is putting women in like a 12-week training program during pregnancy is much more effective in preventing low back pain after pregnancy than not having that training program. So it is absolutely vital to be working out during pregnancy. It's not, it's not to that time to just be like, okay, well, you're not this frail, fragile old woman having this baby. You're an active mom. You're an active mom to be that's been in the house, and now is definitely not the time to stop it. So, I think, and that's why I was excited to talk with you, because this is where we communicate very well in developing this training program for women out there. I think if you're going to be working out though, and you really want to prep yourself and prevent low back pain, yes, keep up with some of those oblique exercises, but it's very, very important to get that pelvic floor and lower extremity activation too. So something I recommend to every pregnant woman, and this applies to pretty much anybody at any fitness level, are just body weight squats. It sounds simple, it sounds easy, but it's a really, really effective that doesn't put too much resistance on you, and it's still very, very doable throughout the stages of pregnancy. If you feel like just a normal body squat is too much for you, try doing a body squat, assisting yourself down with like a table or a band, helping guide you down into the squat can make a big difference with that.
And this would be for someone probably, during pregnancy, maybe that has not been doing a lot of exercise. These types of movements would be pretty safe for just about anyone without any sort of contraindications from their doctor.
Yes. Yep. You got it. Yeah, absolutely. So you don't have to be working out every single day in the gym to be able to perform some of these exercises that I'm going to talk about. Anybody in any fitness level can jump in and do them. But bodyweight squats, I think, it's easy and it's a great place to start if you're trying to figure out a workout into your program there.
That's great.
Yeah.
Yeah. What were you gonna say?
Oh, I was just gonna say another one would be like a glute bridge.
Mm.
But putting a foam roller or something, even a ball in between your legs, get that adductor activation as you're holding that glute bridge. What that does is it works those muscles around your hip and pelvis to really strengthen them and get them ready during pregnancy and afterwards.
Oh, that's great. I did
Mhm.
not know that. So yeah, glute bridge with squeezing foam roller or a small ball or even pillows if you don't have that
Oh,
stuff at home.
yeah, I love it. It's a great one.
Okay. So this will be good stuff, especially if you're really not doing a lot of exercise prior. Obviously, some people might have already been doing a lot of exercise, so they're going to be a little bit more advanced.
Mhm.
What exercises would you recommend for someone who is more advanced? Maybe just loading those exercises more, or are there other exercises you would recommend?
Yeah, so this is where you can start having a lot of fun because when you think about some of the exercises that you can use, when you're engaging with that pressure in your belly, you're loading the pelvic floor muscles. So the world becomes your oyster in the weight room. But something that I think it makes it very specific for pregnant women as a whole is a sumo deadlift. So that's spreading your legs apart and being able to do a deadlift with a kettlebell or dumbbell off the ground. I think it's really, really good. It gets the pelvic floor muscles working, but it also helps strengthen the muscles of the hip as well. So for somebody a little bit more advanced, that is a perfect exercise for you. And then I would engage even the bird dog and the dead bug can become a really powerful workout tool that you can progress as well. So I definitely recommend throwing that in the workout there.
No, that's great. We got dead bugs, bird dogs, glute bridges with adductor or groin muscles working. For people who don't know what that means. Body weight squats, sumo deadlifts, these are all great places to be for during pregnancy. Post pregnancy, these would still apply.
Mm-hmm.
Obviously, I feel like post pregnancy, you might be able to start to explore and start pushing yourself over time. Um, how do you feel about lunges? If someone doesn't have any issues post pregnancy, you feel like lunges would be okay to throw in there?
Yeah, I think lunges are really, really good. The reason why I listed the exercises I did, because it's much easier to focus on the pelvic floor activation when you have both your legs in the same position. The stability requirements aren't as high as necessarily a lunge. That
Yep.
being said, like I said, if you've been around the gym for a while, if you feel like you're able to do that move without any issues, then by all means, like it's not going to hurt you. So don't think that like just because you're moving and working out that it's going to end up causing you low back pain. That's not what the research says. The research says that like these type of workouts are going to be what prevents you from having that back pain. So yeah, 100%. I think lunges are great, especially if you're not having any issues with single leg stability or something like that.
Yeah, you mentioned so bilateral motion, which means both sides, guys, if you're
Mm-hmm.
not sure. Bilateral motion is usually much easier to stabilize, so you're better able to control the movement. And I have found this for myself when I did have some back issues. There sometimes single leg would give me trouble because there was some sort of instability going on in there, and it's much harder to get it stable. So make sure you can do these other exercises well first before you sometimes take that next step. There's always progressions and regressions to everything we're doing here, and so usually we can find a regression or a progression of just about any exercise I feel like that we can do without any issues. Everybody's a little different. Everybody's back discomfort's different. Everybody's physiology is different, structure is different, anatomy. So it all really, you have to look at all of that and feel like, if this exercise bothers you, well, it doesn't mean that you have to stop all exercise. Try a progression. Um,
Yes, I love that. I absolutely love that. And I think you're spot on, right? Like I think always look at the workouts. It's the best thing you do well, right? So like if you're really, really good at body squatting, but like a sumo deadlift, it just doesn't feel comfortable, it's maybe causing you a little bit of pain, then don't do it, right? Like do the workout that makes sense for you. The focus just needs to be on doing that exercise really, really well, right?
Yeah.
So it's mainly about the quality of these things. And if you're not having issues, then add more and add more and more and more. Add what you can handle. But those few exercises there at least gives you a solid foundation. So if you want to build on that, please go ahead. Like I'm not trying to limit anybody that's trying to work out more by any means.
Yeah, that's really important. We want to keep moving. Even if we have some issues going on, usually just sitting around doing nothing is not a good thing. I mean, you don't, I think this is a great opportunity for us to talk about that really quick. I know you've talked about it with me before, but at what point do you say, all right, what you're experiencing now, you need to go see somebody? And when do you say, well, just give it a few days, see how you feel?
Mhm.
That's kind of a tough place for people
Yeah.
because they don't know what to do. And I mean, I don't want people to be too aggressive, but also at the same time, I mean, I want people to be conservative enough, but at the same time, like go get the help when maybe they should. So, what
Right.
are your thoughts on that, especially dealing with pelvic floor, low back stuff? What would you look for?
So first off, I would just say, if you ever have any questions, concerns about what you're going through during pregnancy, always contact your OBGYN. They're going to be the first people you want to talk to. But outside of that, if you're dealing with like true mechanical low back pain, some things that I would definitely take into account are red flags, if you will. Sciatic type pain, so any like radicular type of pain like that, that's something that becomes a lot harder to manage on your own. So I do recommend seeing somebody who specializes in mechanical low back pain, like myself, Dr. Waters, or even if you're not in the Indianapolis area necessarily, there's other people that I can recommend to you. But somebody that can check that out and help you out, because that's something you definitely don't want to deal with during pregnancy. Having sciatic type of pain, it tends to be rarer than just run-of-the-mill low back pain, but it's definitely prevalent in the pregnancy population. So that's something that I recommend dealing with before the pregnancy, or if it's after dealing with it then. And then the other thing is if you just feel like you can't move, it's stiff, like every range of motion seems to be hurting, that's classic mechanical low back pain. And that's when I would go in, have somebody evaluate it, see if like, okay, this is coming from your joint, this is coming from your muscle, and this is what you need to do. Because at that point, if you can't move, you can't do the workout, well, you can't really prep your body for what's going to happen during birth and what comes afterwards. So at that point, it's really, really good to meet with somebody, get a game plan, have them work with you, so that way they can get you back to working with somebody like Zach to keep working on that training program.
Yeah.
So those are two big things that I see. And then SI joint pain is very, very common in the pregnant population. It's something that's very, very treatable, but not something that's always the easiest to treat on your own, right? So
Mm.
if you feel like that pain's coming from your hip or anything like that, that's another good time that I would ask the questions and seek treatment.
That's a great point. Awesome. I think with sciatic, I think a lot of people feel some weird feeling sometimes down their leg, right? It can present in a lot of weird ways where it's because it's a nerve, and that whole nerve runs down your leg, correct?
Yes. Yep. And sometimes
So
it's not even the sciatic nerve that's the issue. It could be coming from the lumbar discs. Pregnant women put in a phenomenal amount of compression on their low back, which part of that is the lumbar disc of the spine being compressed. So
yeah.
sometimes it could be coming from the lumbar disc, which we have rehab protocols for. And sometimes it's true sciatica. And then you kind of have to diagnose that and figure it out and meet the patient where they are.
Okay. And what if someone's got, say that they're 3 years out of pregnancy,
Mm-hmm.
they had a kid 3, 4 years ago, and they have back tightness, and it doesn't necessarily keep them from doing stuff. It doesn't throw out. It doesn't give them sharp pain. It's just this back tightness that's persistent. In that type of situation, if someone described that to you, um, would you recommend, are there, would you recommend them seeing a doctor to get that checked out?
Yeah, 100%, because you're gonna feel better about it. You're gonna feel more
Yeah.
comfortable once you know exactly what's going on, and more importantly, how to manage it. So a really good chiropractic physician or physical therapist will treat you, explain what's going on, and then give you the tools to manage it on your own. And then that's when we open up our relationship with great trainers like Zach here and say like, hey, like this is what's going on. Here's what it is. Here, can we work out a training program for what this patient's dealing with right now?
Yeah, that's great. And what about, are there any sort of, again, exercises that people can do that are just feel good, that just gets them, able to move around a little bit better? Are there maybe 2 or 3 exercises you might recommend before workouts or after
Yes.
workouts just to kind of keep them healthy? What would you recommend that might be?
So one of the biggest things, just not only in pregnant women, but in the general population, is mid-back extension. So a lot of people get really stiff around their mid-back. So one thing I'd recommend doing is, if you're pregnant, it becomes a little harder. So what I recommend doing, a lot of people recommend the foam roll. That's not always comfortable with pregnant women. So what I actually recommend doing is going on your knees and placing your elbows up on a tabletop or something like that, sinking into as much mid-back extension as you can get, and holding it there for about 10 seconds, relaxing, and then seeing if you can sink further. Repeating that cycle for about 2 or 3 times will add a little bit of extra mobility in the mid-back, and it won't be as comfortable as just laying on a foam roll at times.
Right.
So thoracic extension is a big thing I recommend. And then another thing is just, and this is what I personally do this after every single workout. I lay on my back, I prop my feet up, and I just breathe into my abdomen. So what that does, it actually does 2 things for us. One, it safely and very easily helps loads the oblique muscles of our back. So it kind of helps decrease the tension in the extenders of our low back, or our erectors, right? The muscles right in our low back here that are commonly cause us pain. But it also helps puts us in a parasympathetic state. So if you guys don't know what that is, there's 2 nervous states. One of them is basically like a fight or flight, right? We use that when we're being chased by a bear or something. Parasympathetic is what helps us relax. So just getting on your back and breathing in your abdomen is what helps prep that parasympathetic system. So it's another great tool to use post-workout. I highly recommend it. Even before, just does a really, really good job of relaxing and prepping your body for the workout. And then the other thing I recommend is doing a little bit of myofascial work around the glutes. So it doesn't have to be anything crazy, but if you put like a foam roller or something like that underneath your glute region here, and put your leg on top of your other leg and press your knee down, almost like you're in like a butterfly position, that way they call in yoga. What that does is, as you press it down, it helps stretch that glute muscle there, and then bring it back up once you feel like you got a nice stretch, press it back down. Going through a couple cycles of that will help decrease some of the tension in your muscles so that you're good and ready to go before you're working out. Oh, Zach, I can't hear you.
There we go. There we go. So I got the kids yelling in the background, so I have to mute the mic a little bit.
No, you're
So
good.
no, thank you so much for giving some advice on some of those, pre-workout or post-workout exercise they can do just to get moving better, to kind of prevent some of these issues that can occur. And I think you had mentioned that maybe you might be able to post at least a couple or a few of these exercises on your Instagram account.
Yeah. Yeah.
Um,
So
yeah.
Instagram's just a great way to get a hold of me in general, but I like posting videos like that for just a variety of different reasons. I like educating people. So I will be doing a little series here where I'm going to get into about 3 or 4 of these exercises, just so you guys have that if you need it. And then you can always contact me and ask questions. Like I said, I'm pretty active on Instagram, so it's a great way to get a hold of me if you have questions on any of those videos.
Excellent, man. What's your tag on there again?
It's just Dr. Alec Domjan.
Okay, great, great, great. I'm going to put a link to that when I make some adjustments to the content here. on this post for you guys, so you can just click the link, go right over to his page, check out his stuff. I'll let you guys know once he's got that stuff up. And really appreciate having you on here, man. Thanks a lot for providing so much value. And thank you for everybody that came by to watch. If you have any other questions, feel free just to comment below this video and let us know. If you want to contact Dr. Alec Domjan himself, go ahead. Feel free to message him. He's in the Facebook group. And again, I'm going to post his Instagram account as well. So feel free to reach out. Again, thanks a lot. And hopefully you guys all have a great day.